A nurse is teaching a 20-year-old male client newly diagnosed with herpes simplex virus, HSV, type 2. All of the following teaching points in regards to this condition should be included except which of these? A. HSV is a lifelong infection, with recurrent infections possible to the skin and mucous membranes. B. Certain factors may exacerbate the condition such as sunlight exposure, trauma, stress, or systemic infections. C. Transmission of the virus is possible by respiratory droplets. D. Recurrent episodes of HSV may exhibit grouped vesicles on an erythematous base. E. Nystatin is a common drug used to treat flare-ups of skin lesions associated with HSV. The answer is E. Nystatin is a common drug used to treat flare-ups of skin lesions associated with HSV. Nystatin is an antifungal medication, not effective in treating viral infections such as HSV. Antiviral medications such as acyclovir, famciclovir, and valacyclovir would be prescribed to control symptoms and shorten episodes. These drugs are not curative. 35-year-old male has just been admitted to the emergency department in a sickle cell crisis. The nurse caring for this client is aware of the signs and symptoms associated with this condition. The proper nursing management for this patient should include which of these? A. Strict bed rest and hyperbaric oxygen therapy for 2 hours. B. Blood transfusions and antibiotic prophylaxis. C. Large doses of continuous analgesics for pain and oxygen to control sickling of the red blood cells. D. Give platelets and monitor hemoglobin and hematocrit levels hourly. E. Heparin administration and iron replacement. The answer is C. Large doses of continuous analgesics for pain and oxygen to control sickling of the red blood cells. A sickle cell crisis will require interventions to control the client's pain due to widespread tissue ischemia. Oxygen is needed to treat hypoxia and control the amount of red blood cell sickling. Blood transfusions are usually not first-line treatment in a crisis. The SIRS, Systemic Inflammatory Response Syndrome, criteria includes which of the following? A. Respiratory rate greater than 30 breaths per minute. B. Heart rate less than 100 beats per minute. C. Temperature greater than 38 degrees centigrade. D. PCO2 45 to 55 millimeters of mercury. E. None of these. The answer is C. Temperature greater than 38 degrees centigrade. The SIRS criteria includes 4 factors. 1. Temperature greater than 38 degrees centigrade or less than 36 degrees centigrade. 2. A respiratory rate greater than 20, or PCO2 less than 32 millimeters of mercury. 3. Heart rate greater than 90 beats per minute. And 4. WBC greater than 12,000 per cubic millimeters, or WBC less than 4,000 per cubic millimeters, or immature neutrophils greater than 10% bands. To meet the SIRS definition must have 2 or more of these findings. The fact that an elementary school is shut down due to a measles outbreak is an example of an N-A. Epidemic. B. Sporadic disease. C. Pandemic. D. Endemic disease. The answer is A. Epidemic. The terms outbreak and epidemic are very similar, except an outbreak is confined to a smaller place. Both indicate an increase in incidence of disease. An endemic disease is always present in the community in a low level. An example is the common cold. A pandemic is an epidemic that occurs across multiple continents. A sporadic disease occurs randomly or in scattered incidents. Which of the following physical exam findings would you expect to find in a patient who overdosed on heroin? A. Shallow breathing, normal respiratory rate, dilated pupils. B. Deep breathing, low respiratory rate, dilated pupils. C. Shallow breathing, fast respiratory rate, pinpoint pupils. D. Shallow breathing, low respiratory rate, pinpoint pupils. E. Deep breathing, fast respiratory rate, dilated pupils. The answer is D. Shallow breathing, low respiratory rate, pinpoint pupils. Opiate, heroin, overdose is marked by a decreased respiratory drive, shallow breathing, and pinpoint pupils. Treatment is with naloxone and reverses overdose quickly. Heroin overdoses can be fatal if untreated because of the respiratory depression. A patient arrives to the ER in a comatose state. He is shallowly breathing, appears disheveled, and has pinpoint pupils. There are track marks on his right arm and it appears swollen. Which of the following conditions does this patient likely have? A. Opiate overdose. B. Benzodiazepine overdose. C. Alcohol overdose. D. Aspirin overdose. E. Anticholinergic overdose. The answer is A. Opiate overdose. This patient likely has opiate, heroin, overdose. Common signs of overdose include altered mental states, decreased respiratory rate and effort, and pinpoint pupils. Treatment includes inhalation of naltrexone to remove the opioids off their receptors in the body. Additionally, track marks are a sign that the patient injects heroin. A 23-year-old female comes in for urinary frequency and dysuria. This morning she noticed that her urine seemed slightly tea-colored. On UA the nurse sees a large amount of leukocyte esterase, moderate red blood cells, and a pH of 9.5. On lab analysis a gram-negative anaerobic bacteria with swarming motility is cultured out of her urine sample. If the organism identified in this patient's urine sample is Proteus mirabilis, which of the following would be the appropriate treatment? A. A 3-day course of either oral quinolone or trimethoprim, sulfamethoxazole. B. A 14-day course of ampicillin or cephalexin. C. A 21-day course of ampicillin or cephalexin. D. A 10 to 21-day course of oral quinolone or trimethoprim, sulfamethoxazole. The answer is A. A 3-day course of either oral quinolone or trimethoprim, sulfamethoxazole. The first-line treatment for uncomplicated urinary tract infection with Proteus mirabilis is a 3-day course of either oral quinolone or trimethoprim, sulfamethoxazole. 10 to 21-day courses are only appropriate in patients with complicated UTI or co-infections. Ampicillin and cephalexin are poor choices for initial treatment due to a 10 to 20% rate of resistance in Proteus species. A 23-year-old female comes in for urinary frequency and dysuria. This morning she noticed that her urine seemed slightly tea-colored. On urinalysis the nurse sees a large amount of leukocyte esterase, moderate red blood cells, and a pH of 9.5. On lab analysis a gram-negative anaerobic bacteria with swarming motility is cultured out of her urine sample. This individual is most likely experiencing a urinary tract infection, UTI, due to which of the following organisms? A. Proteus mirabilis. B. Staphylococcus aureus. C. Escherichia coli. D. Staphylococcus saprophyticus. The answer is A. Prochus mirabilis. While all of the organisms listed are capable of causing UTIs, Staphylococcus species are all gram-positive. Escherichia coli, while responsible for 75 to 95% of all UTIs, would not result in a urinary pH of 9.5. The high alkalinity of this patient's urine suggests a urea-splitting bacteria such as Prochus. A 23-year-old female comes in for urinary frequency and dysuria. This morning she noticed that her urine seemed slightly tea-colored. On UA the nurse sees a large amount of leukocyte esterase, moderate red blood cells, and a pH of 9.5. On lab analysis a gram-negative anaerobic bacteria with swarming motility is cultured out of her urine sample. In the case of chronic Prochus mirabilis infection, which of the following is a common sequelae? A. Pelvic inflammatory disease, PID. B. Bladder cancer. C. Renal calculi. D. Infertility. The answer is C. Renal calculi. Due to its production of ureas, Prochus mirabilis infection results in alkalinization of urine, as urease hydrolyzes urea to produce ammonia. This can cause the formation of calcium, struvite, or apatite crystals in the urine, which may form renal calculi. P. Mirabilis is not associated with increased risk for infertility, PID, or bladder cancer. You are the nurse taking care of a 21-year-old female who complains of 2 days dysuria, that over the last 24 hours has been accompanied by fever, chills, and lower back pain. Her physical exam is remarkable for right-sided costovertebral angle tenderness. Which of the following is the most likely diagnosis? A. Genital herpes. B. Primary syphilis. C. Pyelonephritis. D. Pneumotrax. E. Spinal stenosis. The answer is C. Pyelonephritis. The patient's presentation with dysuria that progresses to include fever, chills, and lower back pain, is a very classic presentation of pyelonephritis. Pyelonephritis is an infection of the renal parenchyma, most commonly due to an ascending urinary tract infection. In this patient, who is a female, which places her at a greater risk for UTIs as compared to males due to females having shorter urethras than males, who initially has dysuria, this is a convincing story for a UTI. Further, the fact that the symptoms of fever, chills, and lower back pain are not present initially with the dysuria, but develop over the next day, is further evidence that pyelonephritis is the likely diagnosis. The physical exam finding of unilateral costovertebral angle tenderness also is highly suggestive of pyelonephritis. The other choices are incorrect. Spinal stenosis is not a common diagnosis in young, otherwise healthy patients, and would not account for dysuria and unilateral costovertebral angle tenderness. Pneumotrax would not cause dysuria and would likely present with shortness of breath. Primary syphilis and genital herpes would not account for dysuria, lower back pain, or costovertebral angle tenderness.